Hello, I am an office coordinator in the Division of Academic General Pediatrics at the Children's Hospital at Montefiore, and we thought you'd like to learn a bit more about the program and what it's like to train and work with our faculty. So let's take a few moments to meet some of our faculty.
My name is Dr. Suzette Oyeku. I'm the Chief of the Division of Academic General Pediatrics, and I'm also the Director of the Academic General Pediatrics Fellowship Program at the Children's Hospital at Montefiore, otherwise known as CHAM. CHAM is the pediatric hospital for the Albert Einstein College of Medicine, and it's also part of the Montefiore Health System, which spans the Bronx and Westchester counties of New York. Our faculty and staff live out our institutional values of humanity, innovation, teamwork, diversity, and equity. We have a multidisciplinary and talented team of over 70 providers, PhD-level researchers, psychologists, psychiatrists, nurses, social workers, and an amazing administrative staff. We deliver innovative pediatric primary care to children and adolescents. We are also actively engaged in medical education, quality improvement, clinical research, professional development, and advocacy activities.
As Associate Division Chief of Clinical Affairs, I manage our clinical teaching practices within our division to ensure we provide high-quality coordinated care that is culturally informed and equitable. Our faculty, fellow, and residents care for an ethnically diverse patient population and use innovative care models to promote overall health and well-being of children. Our faculty have a wide range of clinical expertise, ranging from pediatric primary care to children with special healthcare needs and medical complexity, adolescent medicine, behavioral health, developmental and learning difficulties, immigrant health, adoption medicine, and child abuse pediatrics.
We are committed to and intentional about supporting our trainees, faculty, and staff to help them attain their personal and professional goals. In my vice chair role, I'm responsible for enhancing faculty engagement and promoting well-being through the faculty development workshops and trainings, including the CHAM Peer Mentorship Program. The CHAM Peer Mentorship Program focuses on increasing academic productivity for junior and mid-career faculty and provides a developmental network for all participants. I provide individual developmental coaching for any faculty member in the department, and I'm also responsible for promotions and appointments within the department.
An essential part of our institution's mission is to teach. As a co-clerkship director of the Pediatrics Clerkship at the Albert Einstein College of Medicine, I teach our medical students about the care of children and adolescents along with our division faculty. Our faculty members also serve as leaders in our pediatric residency and undergraduate medical education programs at CHAM and Albert Einstein College of Medicine. Our physicians have received several awards highlighting their excellence as educators. We are committed to creating an environment that fosters a culture of inquiry and lifelong learning.
As a faculty member here and co-leader of our division's education committee, I can say that one of the biggest joys in my career is being able to watch the transformation of trainees in clinic. They come in on that first day feeling nervous, unfamiliar, and then within a few short years, they have a devoted patient panel and have become a true member of our clinic's family. It's a privilege to be able to teach you, but also to be able to learn from you. This year, in response to the COVID-19 pandemic, we have had to quickly transform our residents' ambulatory curriculum. We have innovated with some changes like telemedicine to be able to allow the residents to care more safely for their patients and their families. Also, as the fourth-year pediatric ambulatory elective director, we have bolstered our curriculum to better address really important topics like health equity and how to address racism and perceived discrimination with patients and their families.
As Associate Director of our Academic General Pediatrics Fellowship Programs, I work closely with our fellows over the course of their 2 years of their fellowship training. We prepare the next generations of leaders in academic general pediatrics by providing our fellows with rigorous training in research methods, clinical care, medical education, and policy development. We offer the opportunity for fellows to tailor their training experience based on their specific areas of interest with mentorships from our program faculty. We also provide additional leadership development opportunities. which will uniquely position you to address the pressing health issues that are facing our children and adolescents today. Our current and former fellows have presented their scholarly work at regional and national professional society meetings, received awards for their research, and published their work in peer-reviewed manuscript. We look forward to meeting you soon.
I serve as the Division Office Coordinator at one of our teaching practices, as well as the Fellowship Coordinator for our Academic General Pediatrics Fellowship. As the coordinator, I'm responsible for managing all of the administrative aspects of our fellowship program, from recruitment to ensuring a smooth onboarding process. I also work in collaboration with our program directors and our faculty to support you with everything you need to ensure you have a wonderful and impactful training experience. It is really exciting to meet the fellowship candidates because you never know who will be the next person to transform child's health care. Is that person you? I can truly say that this is a great division because everyone embodies the saying, teamwork makes the dream work. During the height of the pandemic, our pediatricians and mental health providers noticed that our families were having difficulty getting essential supplies to care for their infant children. Our division came together to source donations and assemble and distribute infant survival kits that included diapers and wipes and other much-needed supplies to hundreds of families. This is humanity at its best.
I'm a second-year fellow in the Academic General Pediatrics program. I was drawn to the program because it provides me with the perfect combination of mentorship and independence to foster my growth as a clinician, educator, researcher, and advocate. Through the Einstein Clinical Research Training Program, I have deepened my knowledge of research study design, epidemiology, statistics, and data analysis. The training I've received through the fellowship has uniquely positioned me to understand how to provide culturally informed clinical care and conduct impactful research. This program is geared towards propelling your academic career to the next level in a rigorous, collaborative, and supportive environment. I've had an incredible time at CHAM, and I'm so glad I chose to train in this program.
Not only will you be welcomed into a division that really cares about education, but the department does as well. Let me tell you about 3 different curricula that are really engaged in supporting your education. First, let's talk about FRAME. FRAME is an acronym for Fellows and Residents as Medical Educators. During your retreats, what we're going to do is talk about how to give feedback, how to do your evaluations, and all the things that really should matter to you as you become a better educator. The second acronym is THRIVE. THRIVE is an acronym for Teaching House Staff Resilience, Inclusion, Value, and Equity. Especially at a time like this, we think it is critically important for our house staff to learn about diversity, inclusion, and equity issues. And so during town halls, during retreats, and during many opportunities, we're going to have the chance to talk about these things in a really meaningful way. That is going to include conversations about microaggressions, implicit bias, and imposter syndrome. The third and the final one is called DEEP. So we think it's important that you learn how to be educators, but it's also important that our faculty do as well. DEEP is an acronym for the faculty. It is Developing Engaged Educators in Pediatrics. And what we do in that is have our faculty learn how to be better educators. These are 3 curricula that we have developed here at Montefiore to help make you be a better educator as a fellow.
Another important mission of our institution is to discover. Over the course of my career as a general pediatrician and NIH-funded physician investigator, I have applied the skills I learned in the Einstein Clinical Research Training Program to discover community, clinic, and school-based interventions to improve the care and health outcomes of children and adolescents with chronic conditions such as asthma. As a fellow or new junior faculty member at CHAM and Einstein, you can work with multiple NIH-funded internationally recognized faculty who engage in basic science, translational, clinical, and community-based research, as well as quality improvement science. CHAM and Einstein create an atmosphere conducive to multidisciplinary collaboration.
My fellowship program set me up for success with outstanding clinical and research mentorship that was tailored to meet my specific research interests and career goals. My clinical work fed directly into my research, and I was able to complete an impactful research project during my fellowship. My fellowship was an amazing experience, and you should come check it out.
I'm a faculty member in the division who came to CHAM right after completing my General Academic Pediatrics Fellowship. I was drawn to the division's strong commitment to providing high-quality care, conducting patient-centered research, and maintaining community academic partnerships. I've been very fortunate to collaborate with division faculty on research projects focused on addressing social determinants of health in order to advance the health of the communities that we serve.
As faculty member and medical director of community and population health, I lead our health system's efforts to address the unmet social needs that affect our patients and their families. Our community linkage to care model works to collaborate with families to connect them to needed services. I am fortunate to collaborate with our division faculty to conduct health services and implementation research that leads to a better understanding of social determinants of health, improved healthcare quality, and overall population health.
Now that you've met some of the amazing members of our team, I'd be excited for you to consider joining us here in the Division of Academic General Peds here at the Children's Hospital. We would love for you to help us to advance our mission to heal, to teach, to discover, and to advance the health of the communities that we serve.